Good morning, welcome to Salina Regional's Morning Medical. Today's program we're going to be talking about the significant role that nurse practitioners and physician's assistants play in medical care. With me I have Amanda Ewertz, who is a nurse practitioner with Salina Regional Urgent Care Clinic, and Justin Long with the Heart Center as a physician's assistant. Thank you so much for being on the show. Amanda, we'll start out with you and talk about a little bit of your roles at the clinic and what, as a nurse practitioner, you do.
Well, on a day-to-day basis, we are seeing patients, evaluating them, diagnosing them, interpreting labs, ordering those as necessary, and then treating them as we need to. And in urgent care settings, so for non-life-threatening, conditions that maybe need just a quicker appointment than seeing your family physician, essentially.
Okay. Justin, how about at the Heart Center?
Sure. So primary role and most of our time is spent in the operating room. On top of that, doing rounds on the service as well. So following up with all the post-operative patients, making sure everything's going as planned, and then getting them discharged accordingly.
Okay. And you're scrubbing in with the surgeon?
Sure. So we assist on cardiac, thoracic, and vascular cases. So we do everything with the surgeon.
Okay. Let's talk about the differences and maybe some of the similarities between a PA and a nurse practitioner as far as education and day-to-day activities.
So one of the biggest differences lies, I think, in the education and the training between nurse practitioners and PAs. Nurse practitioners are nurses first, so we get our RN degree, your BSN, Bachelor's of Science in Nursing, and then go on to either a master's or doctorate program specifically for APRNs or nurse practitioners.
How as a PA?
So with PA, I guess one of the things that's a little bit more unique is there is not necessarily any experience required before you start school. So after you finish your undergrad, you may or may not spend time in a medical field of some type. The program I went through was actually kind of unique in that you actually had to have 6,000 to 8,000 hours of experience in the medical field to be an applicant, whereas most programs, they'll take you straight out of your undergraduate, just like medical school would. So the PA program itself, most are 2 years, some are 3. There are some programs that specialize. I know one where I trained was specific towards pediatrics. Some are specific towards surgery. So your first year is didactic, your second year is rotations out in the field, hands-on, learning how things go.
Okay, very good. Thank you so much for being on the show, and thank you for watching. For more information, like us on Facebook and follow us on Twitter.